So now we're going to talk a little bit about the sleep stages and why we sleep, or theories as to why we sleep. Reality is we don't know why we sleep. But I can tell you about our speculations. Uh, so in the sleep lab, we study ultradian rhythms. These are rhythmic cycles within a period less than 1 day. Examples include levels of alertness throughout the day and the cycles of brain activity during sleep. Sleep labs use three tools usually known as an EEG, an EMG, and an EOG. EEG studies brain waves, EMG studies muscular activity, EOG studies eye alertness, responsiveness, primarily in association with REM activity. Um, so with EMG, we would study changes in muscle tone. With brainwave activity, EEG. With eye movements, we're studying EOG to get at REM. It's also common to add pressure transductors to look for changes in respiration or genital activity. During certain stages of sleep, you can see an erection in males and production of fluids in females. Temperature transducers can also be applied to assess for blood flow to the genitals and see how, for example, that might respond to a particular stage of sleep or add some sort of chemical to the air. Do you see a change in the two, for example? During wakefulness, you see two patterns of activity in association with brain waves. These are beta activity and alpha activity. And in most phases of sleep that we're going to be talking about, we're primarily going to be talking about EEG output. Um, so beta activity would be irregular activity of about 13 to 30 hertz. It's generally associated with a state of arousal. And you also see desynchrony, suggesting that many neural circuits might be actively processing information concurrently. By contrast, during alpha activity, you see smooth electrical activity of 8 to 12 hertz that's recorded from the brain and is generally associated with a state of relaxation. Theta activity are EEG waves of 3.5 to 7.5 hertz that occur intermittently during early stages of slow wave sleep and REM sleep. Delta activity is regular synchronous electrical activity of less than 4 hertz. It occurs during the deepest stages of slow wave sleep. Overall, this produces our sleep stages. There are 5 identified stages of sleep. It takes about 90 to 100 minutes to pass through the 5 stages. The first 4 stages are known as non-REM sleep, and the 5th stage is called REM sleep. In stage 1, this is experienced as falling asleep and is a transition stage between wake and sleep. It usually lasts between 1 and 5 minutes and occupies about 2 to 5% of a normal night's sleep. It consists mostly of theta waves and may lead to hypnagogic imagery. This is described as ghosts by some. Mary Shelley, it says that her visions of Frankenstein first emerged as sort of hypnagogic imagery. Salvador Dali, would paint in this sort of sleepy, sleep-deprived state and credits a lot of his work for hypnagogic imagery. You also see myoclonic jerks, which I'm sure we've all experienced. This is where we, feel one of our muscles or arms or legs jerk as we are falling asleep. I've also felt this at the theater or sometimes during a boring lecture. Stage 1, I've already mentioned you may experience hypnagogic imagery, something like ghosts, or myoclonic jerks. In stage 2, this follows stage 1 and is the baseline of sleep. This is where you also go to after REM sleep. You go back to stage 2. This is also where you see the first K complexes, which are associated with the consolidation of dreams. or the consolidation of memories in association with dreams. This stage is part of the 90-minute cycle and occupies approximately 45 to 60% of sleep. It is during this period that sort of the stamping and the consolidation of memories in the hippocampus is thought to occur. Body temperature also decreases, muscles relax, and eye movements cease to occur. Stage 3 and 4 are delta sleep or slow wave sleep and last 15 to 30 minutes. Contrary to popular belief, it is delta sleep that is the deepest of sleep, not REM, really not REM at all. And it's also the most restorative. It is delta sleep that is sleep-deprived brain craves, first and foremost. If you're in a sleep-deprived state, you're more likely to enter delta sleep more quickly. You also are more likely to enter delta sleep early on in a sleep session, whereas REM sleep increases over the length of a sleep session. In children, delta sleep can occur up to 40% of all sleep time, and this is what makes children unable to wake or in this sort of dead sleep. You know, and fantastic, man. I wish I could spend more time in that deep sleep. Feels good. Some examples of that deep sleep. During stage 5, you get to the REM sleep. This is rapid eye movement sleep and can also be thought of as paradoxical sleep. It lasts between 10 to 20 minutes and composes 20 to 25% of a normal night's sleep. This is where breathing, heart rate, and brainwave activity quicken. The body is paralyzed and it's most associated with some of these vivid dreams that we get. You get theta waves and bursts of beta waves. Everybody has these vivid dreams in REM sleep. Some of us, like myself, have a very hard time remembering them is the problem, but they are still occurring. From REM sleep, you go back to stage 2. Oh, and this is just an image showing that the brain is more active in general during REM relative to non-REM sleep. There's a lot going on. So during REM sleep, you see EEG desynchrony. During slow wave sleep, things are usually more synchronous or more, consistent. You see a lack of muscle tone in REM, but more moderate muscle tone in slow wave sleep. Rapid eye movement in REM, none in slow REM. Penile erection or vaginal secretion in REM, much less so in slow REM, and vivid dreams in REM. Now, right, there are a few, the paralysis that's brought on about by REM sleep occurs in the brain stem and can be disrupted by pharmacology. There are Ambien or Zolpidem. Zolpidem is a very famous drug in regard to this. Zolpidem removes that sleep paralysis in some people, so they end up acting out some of these dreams or sleepwalking and acting. Some of these are quite humorous, like somebody trying to make a sandwich. Some of these are not humorous, like someone trying to make something on the stove, somebody driving a car, somebody acting out their sexual fantasies while asleep, which is can be incredibly dangerous and border on assault. So there is a reason for that sleep paralysis, and that is certainly something that can be interfered with. Here is just a cartoon showing, it rarely goes 1, 2, 3, 4, 5 like this, but this is what it would look like if it were. Key things here to keep in mind is you get the sleep spindles occurring in stage 2. REM sleep is really that paradoxical sleep where you're going to have rapid eye movements, more activity. Deep sleep, stage 4, most restorative, where you see kids in a lot more than adults. Non-REM, deep sleep and REM sleep in general do go away with age. In addition, drug use greatly influences these things. It's a controversial thing, this idea of cannabis dependence, but it is quite clear to me, being an expert in this field, that there is a cannabis dependence, and one of its greatest issues is with sleep disturbances and the ability to enter uh, stage 3 and 4 sleep and REM sleep when you're not on cannabis. So, I mean, if you are not able to sleep deeply or enter REM sleep without cannabis, that is dependency. I mean, like it might look a little different than the diarrhea and things you see with heroin, but not being able to sleep or sleep well without the drug is an incredibly serious thing if you think about it. But anyway, here is just, and it's not just cannabis. Many drugs of abuse produce these deleterious effects on sleep. And I think that it is often overlooked how important sleep is in driving the dependence. So, for example, with alcohol, it's very common that people start using alcohol to cope negatively, and then, after they've done this for a few years, they get to the point that really they cannot sleep or without the alcohol. And then when they're on the alcohol, they're also not entering stage 4 sleep or REM sleep well. So they're just not getting a good night's sleep. And then that drives them to drink more alcohol, perpetuating this whole negative spiral. And you probably see the same thing with benzodiazepines, with barbiturates. It's really a pretty common, consistent feature of drug dependence across all classes of drugs, including cannabis. Here's just a mnemonic device to help you memorize the sleep stages. Bats drink blood, beta, alpha, theta, then the spindles and K complexes come, then delta and back, and then beta. But I do want to point out that, just so you know, from my perspective, knowing these sleep stages, I think, lend themselves much more to multiple choice type questions, for the essay on the exam. And of course, there are going to be multiple essays, but I am more inclined to, assess your ability to describe the neurobiology of the circadian patterns, which I think we have a much more concrete understanding of than understanding like when you are when what beta is associated with most. I'm not saying I won't ask you that on a multiple choice question, but if you're in REM sleep, you would be seeing blank waves. The answer would be beta, but I'm not going to ask you to write me an essay on that one. This is what it might look like a little more realistically rather than the perfect stair shape of different phases through sleep. One patient would be at REM sleep at a few stages throughout the night, and in different levels of REM sleep that fluctuate in somewhat pseudo-random order. I've already mentioned that whether or not you're in enter deep sleep like stage 4 or REM sleep changes across the duration of a sleep session. Early on in a sleep session, you see more stage 4 sleep. So, I mean, I think sort of getting to this idea of restoration and deprivation, when you first start sleeping, you're more likely to enter that deep stage 4 sleep. During a cat nap, you might be more likely to enter this. During a state of deprivation, you're much more likely to enter deep sleep. But maybe because you're sleeping more and no longer in this state of deprivation, you're less likely to enter deep sleep as you continue sleeping, but are more likely to enter REM sleep. And so who cares? Why do we sleep? So there's really not a great answer to this question. We don't know exactly, and there probably isn't one reason anymore. We might speculate that the first reason that sleep was selected for was survival, to reduce predation, and we'll talk about that a little bit. But there are probably a lot of multifaceted reasons for why we sleep. So first, sleep is a universal phenomenon amongst vertebrates. As far as we know, all mammals and birds sleep. Birds have short non-REM and REM sleep, reptiles do have no REM sleep, and I mean there might be a divide there between cold-blooded animals and warm-blooded animals. There's also a relationship between body size and sleep. The smaller the body size, the more sleep that there is. Elephants sleep very little. Little birds sleep quite a lot. This could also be associated with a regulation of body temperature. You know, a big old elephant with lots of built-in insulation is able to regulate themselves a little more than a teeny tiny bird in the snow. Right, there's also an association with animals that live longer tend to sleep less or require less sleep. The amazing bottlenose dolphin is also a consideration, and really this goes with all aquatic mammals. One question is, well, how do they continue to breathe when they are underwater? So the question, this is answered by the realization that the dolphin brain sleeps in turns based on the hemisphere. So each hemisphere sleeps for periods of time, allowing the animal to continue surfacing even during sleep. So how much sleep do we need? Newborns need around 16 hours, college students around 8 to 9, most people around 7 to 10. You know, there are some examples of genetic factors that have been identified that are associated with people that require less sleep than others. You know, in general, I would say that you know, probably a lot is more people think and have this belief that they don't need as much sleep as they do. They're pretty much full of it. You know, I also want to point out that a lot of professionals, more than you might imagine, you know, take things like modafinil to increase your cognitive performance during periods of sleep deprivation. So modafinil is sort of like the new amphetamine. So, you know, your parents generation were given amphetamines to as cognitive enhancers to help perform during periods of sleep deprivation. So, you know, we still do that. There is a safer option now called modafinil, which more responsible doctors prescribe. You know, if you consider a responsible doctor as one that would prescribe psychostimulants for performance. But anyway, this does happen. In fact, I'd be willing to bet that it happens at the highest levels. I would be willing to bet anything that the Surgeon General of the United States gives the President of the United States modafinil on a regular basis. In addition to multiple senators, I would assume that it's just sort of a common thing on Air Force One to have a supply of Ambien and modafinil on hand, depending on if the president wants to go to sleep or needs to be more cognitively alert. So modafinil, you know, I've been on the hall where these studies were conducted. You know, it you know, improves cognitive performance following sleep deprivation. One study of how this was done, you know, the experimenters kept monkeys awake for long periods of time, and then either gave them placebo or modafinil, and found that the monkeys were able to perform higher order cognitive tasks at a better rate on modafinil than they were on placebo. You know, it still wasn't quite as good in the non-sleep deprived state. You know, but the idea here is that if you were in a dogfight in airplanes, for example, you would be much more likely to survive on modafinil than not on modafinil. Now, whether or not that means that every senator and inventor and engineer and medical doctor and nurse should be on modafinil. I'd say it's an incredible problem in society and one that I would like you to think about a little bit about right now. You know, we get up in arms when we think about someone like Tatis using a performance enhancing substance to have an unfair advantage in baseball. But we don't seem to have such a problem with this when we talk about cognitive enhancers. How are cognitive enhancers not academic steroids? How is it fair for one of your peers to be taking modafinil to do better on the MCAT and in medical school then you would be able to off of modafinil. And if you think that that doesn't occur, I'm sorry to be the one to inform you, you're a little naive. Modafinil and the use of psychostimulants as performance enhancers in a variety of professions is an incredibly common thing in America, and I don't see it going away. Like it's sort of that bigger, faster, stronger thing, and yeah. So that, but that is them's the ropes. And what do you guys think? Should modafinil and amphetamines be thought of like steroids? Should we be able to ban professors for a year for using modafinil? Or should we drug test our senators? Alternatively, should we chalk all of our senators up with modafinil so they are performing better? Maybe we want them all on modafinil. I don't know. But it's also important to recognize that you can build up a sleep debt that can have numerous negative consequences. Being sleep deprived one day is bad. Being sleep deprived every day for 7 days is much worse. Over time, this can result in weight gain, depression, increased risk for cardiovascular problems, and just incredibly make you a incredible jerk. Nobody wants to be around you. You also have a decreased immune system and are more likely to get sick here. This shows the REM rebound down on the graph below. So that's primarily what I'm going to focus on, that below graph. So on the y-axis, you're looking at percent of total time spent in REM sleep. You can see the baseline there, the pre-deprivation period. Then they go in and they deprive the patients of sleep. As expected during sleep deprivation, the percentage of time spent in REM sleep decreases. Then they stop depriving the REM sleep. Here you might be keeping them up with loud music or even jostling them every time you can see their brain waves. You can even program the EEG machine, so you start to see them go into sleep. You have like Jean-Philippe Sousa come on. But anyway, you increase the amount of time that you're in REM sleep on day one. Day two is a little bit more, and then day three, you're sort of back to baseline. I think probably most of us have felt this, this sort of rebound phenomenon. So what happens if we don't sleep? The results of sleep deprivation studies suggest that the restorative effects of sleep are most important for the brain, are incredibly important. I mean, like your mental health processes will suffer. However, you're not going to die. Well, you could after a long period of time, but it's going to be because of some other thing. I mean, like, you're not going to just die from the lack of sleep. Something else would be triggered that, would bring that on. Right. So, right, like I said, sleep deprivation studies with human subjects have provided little evidence that sleep is needed to keep the body functioning normally. I mean, like, it's optimally, yes. But can you stay alive and function? Sure, just not very well or pleasantly. The relationship between sleep and exercise is also not very compelling, which is noteworthy. For example, Ryback and Lewis found no changes in slow wave or REM sleep of healthy subjects who spent 6 weeks resting in bed. So I mean, having prolonged rest or periods of exercise doesn't really seem to impact this, which also might speak to the restoration part. I mean, like, if sleep were really there for restoration alone, we would expect this to change with exercise, would we not? Sleep deprivation has also been used as a form of torture, and still is to this day. And I also want to touch on a study, a self-study done by Randy Gardner as part of the high school senior project, which would probably not be allowed these days. But he chose to stay up for 11 days while hooked to a variety of devices and monitor, his physiological and behavioral responses to sleep deprivation. He tried to be the stoic tough guy, I think, and really reported no detrimental effects. He used pinball as his primary objective measure, like whether or not his pinball scores were reduced, and they were not. He was able to maintain high levels of pinball scores. I would be willing to bet that in a dogfight he would have fared worse, or if he was like in a now what we have is like even in driving simulations, but in flight simulations, we have these advanced tools that I think can get a little bit better at one's cognitive ability than whether or not one is playing pinball. But I would have no question that the person would be able to keep the plane in the air, keep the car going. I think that they would be more likely to mess up. And I think they would be more likely to hit a pedestrian in the car, for example, a common one, like, right, they might change the driving apparatus to have the pedestrian cross the crosswalk when they're not supposed to. And I think you'd be more likely to miss that sort of thing, but I don't know. We would have to replicate the study, and I don't think I'm going to get approval to keep any of you up for 11 hours to see what happens. He did experience extreme moodiness, concentration problems, short-term memory loss, paranoia, and hallucinations, all of which would probably impact higher order thinking and requirements. Right. This is a quote basically trying to make the argument here that perhaps, in mammals in particular, sleep could involve the inability of the cortex to control what we think of as our more sort of animal brain, like the limbic structures, the basal ganglia structures that are more conserved across all vertebrate species. So it's almost as though without sleep, the brain is reverted back to more primitive patterns of activity in that it was unable to put emotional experiences in context and produce controlled appropriate responses. It's just, your limbic brain, you're acting without that sort of cognitive top-down check. So generally some theories here as to why we sleep are protection. The idea is that when we're sleeping, we're hidden. So, and animals with the least ability to hide sleep the least. So, for example, the elephant, which is huge, only sleeps 4 hours a day. Cats, which can curl up in any bush or box, can sleep for 14 hours. Chipmunks and bats, which hide notoriously well, sleep for about 20 hours a day. You also have recuperation. The brain recovers from stress and exhaustion. Brain tissue is restored and repaired. Making memories, we've already talked about this a little bit. Corinne Lansink, Lansink, is one person that I've worked with who researches this. But, there's quite a bit of evidence to suggest that during certain stages of sleep, our memories are stamped in throughout the brain, really in different regions. She primarily studies the hippocampus. Creativity, some people argue that sleeping boosts thinking and learning, that problems are often solved after a night's sleep. You wake up with that eureka moment. Growth processes might also be important. Your pituitary gland releases growth hormone during sleep, for example. REM sleep also, or in particular, could be important. Remember, REM sleep doesn't occur in reptiles, but it occurs in warm-blooded animals. And this is a time of intense physiological activity. The eyes dart about rapidly, the heart rate shows sudden acceleration and decelerations. Breathing becomes irregular and the brain becomes more active. So it would be unreasonable to expect that REM sleep has the same function as slow wave sleep. It's probably doing something. But what that is, I don't know, we will see. Researchers have long been struck by the fact that the highest proportion of REM sleep is seen during the most active phase of brain development, REM. Perhaps then REM sleep plays a role in this process, but a lot of this remains speculative. One thing to keep know is that in adulthood, as you grow older, REM sleep and non-REM sleep decrease. Old people tend to have trouble sleeping well. And oftentimes you get into these vicious cycles where you're not sleeping well, and that disrupts various things, and then you might do other things that disrupt the sleep, and it just snowballs very quickly in a way that can lead to cognitive decline, uh, behavioral injury, these sorts of things. In addition, drug abuse can produce the same sort of outcomes. You enter REM sleep and non-REM sleep both more poorly when you are abusing high amounts of a variety of drugs of abuse. So again, there's no single theory that's completely satisfactory. If I were to ask you why we sleep, uh, you know, probably it's multifactorial at this point in time. It's possible that sleep was first selected for just to keep us quiet and alive, survive, but now that we, are not preyed upon as quickly or as readily, at least not in this particular generation, that we have been able to take advantage of sleep for multiple purposes that have allowed us to grow and thrive and create new, amazing, awesome products like this lecture. But yeah, it also, I think, is historically fascinating to know that even recently, we used to wake up in the middle of the night. There was a period of time in society, really just a few hundred years ago, that it was common practice that everybody would wake up at midnight for an hour or two. And the reason was for survival, that it was more likely, you were more likely to survive if you sleep for 3 or 4 hours and then wake up for the night watch and then go to bed for another 3 or 4 or 5 hours after that. If you can make it to 1 in the morning, you're probably going to make it at that point. That the hooligans are going to bed then, and then you can go back to sleep. But yeah. Anyway, that is what I have on why we sleep.